Medical education. Professional English in use. Chapter 11, Medical Education 1. Medical education in the UK. Medical education in the UK covers undergraduate education, 4 or 5 years at medical school, the section of a university responsible for medical education. A 2-year foundation program, which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GPs or consultants, senior specialists, often delivered through college for different specialties. For example, the Royal College of Physicians. Continuing professional development in the form of course and seminars which doctors undertake throughout their working lives to keep up to date. Extract from an undergraduate prospectus. The MBCHP Bachelor of Medicine, Bachelor of Surgery is a 5-year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core, years 1 to 3, an integrated program of clinical and scientific topics, mainly presented through problem-based learning, PBL, where you work with others on a series of case problems. Vocational studies and clinical skills. This component prepares you for the clinical skills required for contact with patients from year 1 of your course. Through periods of practical training where you are attached to a hospital department or general practice. Student-selected modules, SSMS, allow you to choose from a menu of subjects such as sports, medicine, or even study a language as preparation for an overseas elective, a hospital attachment of your own choice between years 4 and 5. Clinical attachments, years 4 and 5, a series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics, and gynecology and general practice. A student's view. Ellen, a medical student, describes her course. I'm just finishing my first year of medicine. What I like about this course is that you're involved with patients from the very beginning. Even in our first year, we spent time in hospital. Much of the course is PBL. We have 2-hour sessions a week. We have 2-hour sessions a week where we work in groups of 8 to 10, solving clinical problems. We decide together how to tackle the problem, look at books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9.00 to 5.00. But now it's mainly group work, although we do have some lectures and seminars where we work in small groups with a tutor. I like all of it, even the dissection. We get to cut up cadavers from the second month of the course. Exercises. Exercise 11.1, match these activities to the stages of medical education in the UK, giving in A opposite. Dissecting cadavers, undergraduate, keeping a lot of surgical procedures observed and performed, postgraduate, working for 4 months in accident and emergency to experience this specialty foundation program, taking a 4-week attachment in obstetrics and gynecology, undergraduate, taking an online course in recent developments in cardiovascular disease, continuing development professional. 11.2, complete the sentences, look at B and C opposite to help you. Just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Problem-based learning contrasts with an approach where each subject is taught separately. These days, lectures are often interactive, with regular opportunities for the students to ask questions. In clinical attachments, students learn how to treat and manage patients. Student-selected modules can be a topic from outside medicine, such as a foreign language. Dissection of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She's a consultant at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topics in a small group with our lecturer. 11.3, match each of these activities to one of the components of the undergraduate course described in B and C opposite. Julie spends 6 weeks working in a small hospital in the Himalayas, overseas elective. A group of students discuss together the possible reasons for abdominal pain after meals in an obese 44-year-old male. Problem-based learning. A small group of students trace the pulmonary artery in a cadaver. Dissection. Oro spends a month working in the pediatric ward of the local hospital. Clinical attachment, and learn how to take blood from an elderly patient. Clinical skills. Human chooses to study travel medicine in his 4th year. Student selected module.